very exciting presentation today by Dr. Randolph Matthews. Dr. Matthews.
Thank you. Yeah, so today I presented data from our recent phase 1 trial of next generation Islatravir-eluting implants, showing that these implants are generally well tolerated and are projected to provide sufficient concentrations of active Islatravir for PrEP for about a year. So Merck has been active in developing anti-HIV drugs for 35 years. Islatravir is a nucleoside reverse transcriptase translocation inhibitor, or NRTTI, that is highly potent and with a long half-life. Oral Islatravir is currently being studied as part of daily regimen and part of a weekly regimen for treatment of HIV-1, and as a monthly regimen as monotherapy for PrEP. The attributes of high potency and long half-life make Islatravir a great candidate for a long-acting implant, and an Islatravir-eluting implant may be an attractive option for PrEP. So previously, we reported results from a phase 1 trial of prototype Islatravir-eluting implants. This study today utilized next-generation implants that have modifications to the backbone, including the presence of barium as a radiopacifier. This trial was a double-blind, placebo-controlled, multi-site trial in individuals at low risk of HIV-1 infection. We evaluated 3 doses of the implant, 48, 52, and 56 milligrams, and implants were placed for 12 weeks subdermally in the upper arm. We assessed tolerability throughout and collected samples for pharmacokinetic analysis of Islatravir and the active Islatravir triphosphate. Today, we shared the results showing that mean Islatravir triphosphate concentrations were above the pre-specified threshold for all 12 weeks in all 3 doses. This threshold is a level at which previous studies, including preclinical in vitro and animal studies and clinical studies of Islatravir, provide support that this is a target threshold concentration for PrEP. Modeling of the data from this trial out to 52 weeks suggests that with the 56 milligram implant, concentrations of the active triphosphate will be above this threshold in all individuals at a year. In this trial, the Islatravir implants were generally well tolerated. There were no serious adverse events or SAEs and no discontinuations due to an AE. There was no clear relationship between dose and AE frequency or severity overall, nor was there a relationship between dose and the specific implant site AEs of erythema, tenderness or pain, pruritus, or induration. Overall, the next generation Islatravir implants led to sufficient active triphosphate concentrations for the entire placement period, and the 56 milligram implant is projected to have sufficient levels in all individuals for a year. The implants were generally well tolerated in the trial, and the results support advancing Islatravir-eluting implants to longer, larger phase 2 trials.